Hey guys, this is Dr. Baker. I've had many of my followers who've asked me questions about multiple sclerosis, so I'll briefly touch over many of the components about multiple sclerosis. Multiple sclerosis is the most common inflammatory central nervous system autoimmune-mediated condition. What does that mean? It means that your own cells start fighting or attacking your normal cells that are in the central nervous system. So it often happens to patients who are younger, patients who are basically residing in the colder environment. So more common in white than non-white. Most common presenting symptom can be any abnormality that involves the eye, either double vision, blurry vision, blindness, and can also involve spinal cord, which can manifest in numbness, tingling, weakness. It can affect your bowel and bladder function. Most often it is somewhat acute manifestation, that means it comes on, but there's also a chronic manifestation of this condition. And for that you need to be seen by a neurologist, and they'll typically get an MRI of the brain. And as you can see on this side, there's a classic finding called Dawson fingers, a lesion that's a white appearing lesion around the ventricle of the brain that looks like fingers basically. And they may also get a spinal fluid sample, and classically oligoclonal band is a classic finding for this condition. There are few related conditions that are also autoimmune mediated that are sister diseases to MS. Another one is called de Vick's disease that preferentially involves the eye, and there's also a lesion in the spinal cord. It could be in the cervical spinal cord, thoracic spinal cord, so that's and the treatment for that is you can use steroid, IVIG, and there are other new immunotherapies available for treatment of multiple sclerosis. But if you suspect you have that condition, I would be seen by a neurologist right away, and there are actually neurologists who specialize in MS, so that's the best thing you can do to get the best care you can get for multiple sclerosis. Hope that answers the question.